Good day everyone, so I'm Jel and Luis Birata from grade 12 ABM Einstein. So for today's video, we will talk about the trending issue today, which is the pandemic or COVID-19. So first we will talk about the definition of pandemic. So what is pandemic? So a pandemic is defined as a pandemic occurring worldwide or over a very wide area, crossing international boundaries and usually affecting a large number of people. So pandemic is the international boundaries of disease which can affect a large number of people that cause of death. Also, we will talk about the definition of the COVID-19 or coronavirus. So, coronavirus or COVID-19 is also known as coronavirus in 2019 that caused by transmission of severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. So, it is an ongoing pandemic of coronavirus disease in 2019. Also, we will talk about the COVID-19 affects different people in different ways. So most infected people will develop mild to moderate illness and recover without hospitalization. So we have first, most common symptoms. There are fever, dry cough, and tiredness. The second one is less common symptoms, acne and pains, sore throat, diarrhea, conjunctivitis, headaches, loss of taste or smell, a rash on skin or discoloration of finger or toes. Lastly, serious symptoms. We have difficulty breathing or shortness of breath, chest pain or pressure, and loss of speech or movement. Also, we will talk about who is at risk for coronavirus. So, the virus that causes COVID-19 affects people of all ages. However, evidence to date suggests that two groups of people are at higher risk of getting severe COVID-19 disease. These are older people, that is, people over 60 years old, and those with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. So the risk of severe disease gradually increases with age starting from around 40 years. So it is important that adults in this age range protect themselves and in turn protect others that may be more vulnerable. So talk about should I do if I feel ill during the COVID-19 pandemic. So first, we need to know the full range of symptoms of COVID-19 such as fever, dry cough, and tiredness. So second is stay home and self-isolate. Third, if you have a fever, cough, and difficulty breathing, seek medical attention immediately. Call by telephone first. The fourth is keep up to date on the latest information from trusted sources such as WHO or local and national health authorities. Next, we need to know what to do to keep yourself and others safe from COVID-19. First, maintain at least a 1 meter distance between yourself and others. That's called the social distancing. And make wearing a mask a normal part of being around other people. The appropriate use, storage, and cleaning or disposal are essential to make masks as effective as possible. So, forget the basic of good hygiene such as regularly and thoroughly clean our hands with an alcohol or wash with soap or in water, and avoiding touching our eyes, nose, and mouth. Now we will talk about the effects of COVID-19 in education. We all know that education today has become changes. So education nowadays has become prominent things as it involves most people to take part in these matters. So the new education system still use the one-way communication since the Department of Education or DepEd Commission on Higher Education or CHED and the President Duterte declared no face-to-face until a vaccine for COVID-19 becomes existent and no one knows when it will end. So the education sector is one of the highly affected by the COVID-19 pandemic. So nowadays we all are staying in our home due to the lockdown policy implemented by the government. So we have using internet, using searching for our activities. So we have a modular and online learnings. So according to the Department of Education or DepEd, they are emphasized that it would not necessarily mean that the teacher and learners will go to school and learn inside the classroom. And to ensure that the new learning system a choice among all others in the new learning environment, since the government changed the situation of teaching using social media. So we have a lot of social media that we use for communicating. So according to the Commission of Higher Education or CHED was to strengthen online platforms and blended learning such as but not limited to Google Meet, Messenger, Zoom, Facebook and YouTube. So there are useful social media today. So both departments will adopt numerous learning delivery options such as no face-to-face, blended learning, homeschooling learners and other modes of delivery. So the department was looking to such as online learning, modular distance learning, blending learning, radio-based instruction, and TV-based instruction. So education is greatly affected by the COVID-19 because it has a disadvantage for all the students, which can be affect their studying, like access internet or having a poor internet, lack of money to buy a load, and it's really hard for some students to self-study because it is not a normal education today, because it is a new normal education today. We have no face-to-face because it helps, because the department was or the government was look for the low cases of COVID-19 and for the safetyness of every student. So by the help of online learning and modular distancing, it helps the student to continue their studying in the year of 2019 to 2020. So until now at 2021, continue by the online learning and modular distance learning. So that's all for today. Thank you, and I hope you have some learning from this video. So keep safe everyone, and God bless.